Chris Hani Baragwanath Hospital is the first government hospital to offer a special treatment that will help men suffering from non-cancerous enlargement of the prostate gland. The condition is known as benign prostatic hyperplasia, or BPH. More than 50% of men over the age of 51 are believed to suffer from BPH, and doctors believe this resume treatment will go a long way to relieve these often painful and uncomfortable symptoms. Let's find out more now from the experts involved. Dr. Robin Friedman is a urologist at Chris Hani Baragwanath Hospital, and he joins us live from here in Johannesburg. Dr. Friedman, thanks for your time this evening. Obviously, when it comes to these kinds of topics, us over here as lay people depend on you to explain it in ways that ourselves as well as our viewers can understand. But when I looked at the numbers affected by BPH, this told me that it was something that so many people watching right now, or families watching right now, would be affected by or know something about. Explain to us firstly, what is benign prostatic hyperplasia? Somebody watching right now might not even know that they have the symptoms.
All right. Well, basically, we're referring to the prostate gland itself, which is a gland just underneath the bladder, which surrounds the urethra, which is the tube where a male will pass urine through. And that prostate is typically involved in semen and fertility and things like that. And typically what happens is that as a male grows older, that prostate tends to enlarge. And as it enlarges, it tends to kind of obstruct the urethra through which a male passes urine. You can almost think of it like the prostate being a donut around a tube. And as it enlarges, it squeezes that tube closed. It's almost akin to standing on a hosepipe. And you stand on the hosepipe and the flow becomes slower. So what most men tend to find as they get older is that their strength of their urination tends to get much slower. They tend to spend much longer at the bathroom. They tend to wake up multiple times at night to pass urine. And it's just an uncomfortable situation. And eventually the problem becomes so bad that they tend to seek our help as urologists.
Now, talk to us about this resume. Sorry, go ahead. You didn't complete your answer. Go ahead.
Okay. Oh, no, I was just going to say, this is not a treatment for prostate cancer. It's a benign growth of the prostate, and we're just trying to kind of help and assist the men with their symptoms.
Well, that is a part of the issue here, because it's almost like prostate is something I get the feeling. I mean, I'm in my 40s, so the men in my life is around that age, and it's kind of like, oh, you're of that age, you need to go have certain things checked out, wink, wink, nudge, nudge. Are we seeing enough men of a certain age look after their prostate health, whether it is to find out if they've got an issue like BPH coming, can you tell if it's coming or not, or indeed prostate cancer, a more serious issue, but also the most common cancer amongst men?
No, definitely. Men typically over the age of 40 need to be checked regularly. We tend to kind of advise on a yearly basis, and we want to check them from 2 points of view with regard to their urination and their prostates. One, we want to make sure that they are able to pass urine effectively. And it's not something that they notice easily, because it's something that comes on slowly over many years. And they typically only seek our help when the problem becomes bad enough. And apart from their voiding or their urination, we also want to check them for prostate cancer. And we do that. We've got a very easy screening test, which is a blood test called a PSA. We do other tests as well, but that's an integral part of the testing. So if we keep an eye on these patients on a yearly basis, we watch their urination, we watch their PSA levels and other things, then we should be able to get on top of problems before they become too significant, we hope.
So tell us about this resume treatment that can help with those suffering from BPH.
So resume treatment is a new treatment in South Africa. It's been brought to us by one of our companies, Boston Scientific. So they've brought the technology into South Africa. It has been used overseas for a few years already, and we have already got quite promising data from overseas with regarding to patient outcomes. Basically what it is, it's a minimally invasive, it's a very quick procedure where we use water vapor or basically steam, which we inject into the prostate through the urethra. It's a very quick procedure, probably taking in the region of about 5 to 10 minutes. And we inject the steam into the prostate in multiple locations. And that steam will then cause that prostatic tissue to essentially burn and die off. And then as it dies, your body will slowly reabsorb the tissue therefore allowing that overgrowth of prostate tissue to open up, and the patient is allowed to pee or pass urine effectively. And typically we see some good results even from about 2 weeks onwards.
Wow, that's a very quick reaction. Now, we're looking at pictures that was taken today at Chris Hani Baragwanath Hospital. I believe today was the first time you started giving the treatment. I mean, doctor, you're saying it's not very invasive. We just take really, really hot steam and we're doing this, that, and the other. I mean, how did it go today? And the person that you conducted the treatment on, what was their feedback to you?
So today it went very well. We in fact, we did 5 patients today.
Sure.
Our patients we started with today, we all did under general anesthetic, just because we have a little bit of a learning curve from ourselves and we're kind of getting on top of the procedure. But our ultimate goal, and how it's often being used overseas, is this is almost being done as an office procedure where a patient can drive themselves to the doctor's office. It can be done under a local anesthetic block, which we call a prostate block. And then the patient can receive the procedure and drive himself home the same afternoon. So this is where we see the big benefit for a high volume center like Chris Hani Baragwanath, for instance, where we have a huge backlog of patients and a massive demand for the kind of surgeries that we can offer. And if my vision is if we can kind of do 7 or 8 or 9 of these patients a day and send them home quickly, and get them out of the queues at our clinics and get them off some medication, then I think it's a fantastic thing for Baragwanath and for the patients of Soweto.
This is the first time it's being offered at a public hospital in South Africa. This is a pretty big deal. How are you going to, I suppose, a big part of it is now to market it, to let people know, to communicate that you have this on offer. How are you going to manage all of that?
So luckily, Boston Scientific, they have donated us the first 10 patients worth of treatment. We've been in discussion with hospital management. They're very keen to kind of get on board with it so far. So our hope is that kind of with these 10 cases that we've started with this media coverage that we're getting now, that we can get public interest going. And then, you know, we would like to come in if there's enough interest, and hopefully the hospital management and government will buy into it. And, you know, we will keep an eye on our results. We will keep all of our statistics. We will make sure that these things are kind of working, that it's an effective process. And if it is, I'm hoping that government will come on board and be prepared to pay for the treatments for our patients.
Now, going by just the excitement of the doctor that contacted me about the story and indeed hearing from you, you really do believe that this treatment can really change the quality of life of so many people?
Definitely do. You know, our results from the States, which have been going on for a few years already, look very promising. You must remember it's a procedure for a select group of patients. It's not for everyone. There are certain inclusion and exclusion criteria that we use. But if we can get these patients passing urine at a rate at which they're comfortable with, which improves their quality of life significantly, then I think we've done an amazing thing. It's by no means I think the best treatment that we have around it for these kind of things, but I think it's a high volume treatment that offers a great rate of success. And I think if we can get through hundreds, if not thousands of patients with this treatment, I think that'll be fantastic.
Absolutely. Just very quickly, if people are watching right now and they want to find out more about the Resume treatment, I'm sorry, I mispronounced it earlier on, where can they find out more?
So probably the best thing we could do is, at least at Baragwanath Hospital at the moment, they can inquire at the urology department at Chris Hani Baragwanath. Otherwise, our patients that are currently known to us, they're more than welcome to chat with our doctors at our urology outpatient clinic, and they can kind of guide the patients in the right direction should we get enough of the capacity underway.